Hello, this is Miss Gray here to begin the unit 5 on infection or asepsis. The importance of reducing infection in the role of a nurse is highly important. This lecture, these PowerPoints, correlate to the content in your book. You are responsible for the content in the book that I have pointed out. However, this presentation, I try to really correlate the things that you should do as a nurse as related to the nursing process, not just reciting the facts that are in the book. So, from this point on, as you know, all of your tests and assessments are based on the nursing process. So let's begin with looking at the types of infection. As a nurse, when you're doing a history or a physical assessment or an intake, you want to gather data. You know that you can gather data from the laboratory results, and you might find that the patient has an infection by the level of their WBCs, or their white blood count. You should know what a normal white blood count level is. You can find it by looking up a CBC in your lab book. CBC stands for complete blood count. A part of the complete blood count are the WBCs, or white blood cell count, which when it is above the normal level, it means that the patient has signs of infection. So you can gather this data, knowing signs of infection from the laboratory data. Labs can also tell you if it's been through a blood culture or a wound culture, can tell you the kind of organism that is causing the infection. So infections can be identified by the microorganisms, and that detection can be discovered through cultures, blood cultures, urine cultures, sputum cultures, wound cultures. And so infections can grow in the body, and they're identified by the cultures. They can be symptomatic or asymptomatic. The patient may or may not have symptoms. And when they do or don't, organisms, infections can result in urinary tract infections, pneumonia, cellulitis, and conjunctivitis, and many, many more. There are communicable diseases are also infections. How many of you have had TB? Had chickenpox or the measles? So communicable diseases, of course, are when the diseases spread from one person to another, and they have to be reported to the health department. It is the role of the nurse to contact the health department if your patient becomes positive for a communicable disease like measles, mumps, or tuberculosis. Another kind of infection are the nosocomial or hospital-acquired infections. What's important to know about the nosocomial hospital-acquired infections is that they are associated with delivery in a healthcare environment. So what you want to remember is that in a hospital or nursing home or a health facility, in those environments, you have many people who are being treated or have been treated with antibiotics. And so without good hand washing by the caregivers, when organisms are transferred from one person to another, they become resistant. Hospital-acquired infections, facility-acquired infections are more resistant to treatment. They're more difficult to treat. So it is because germs do learn. If a person has, one patient is being treated with penicillin and infection is transferred to someone else who's on amoxicillin, and then the antibiotic treatment is changed for the second patient, their organisms are gonna be more resistant to the penicillin, the antibiotic of treatment of the person that initially had the organism, than it would be, and it's going to be more difficult to treat. So it's really important. The key concept to know about nosocomial or hospital-acquired infections is that they happen most often in healthcare facilities like hospitals, and they are difficult to treat, more difficult to treat, and germs learn. It's also important to realize that when patients acquire infections in the hospital, and that their length of stay can increase, and therefore healthcare costs can increase, and so it becomes a difficult process for both the patient and the facility. Iatrogenic infections are infections that result because of a therapeutic procedure. So if, for example, I put in an IV and that IV site becomes infected, then that is a iatrogenic infection because it happened because of treatment the patient received in the facility. Asepsis, it is the fight against infection. So we've talked about the kinds of infection. Now we're looking at fighting infection. But again, just for review, when we're talking about infections, we want to know what they are, what causes them, because again, these are things we're going to assess for, plan, and treat for, because everything involves the nursing process. Asepsis is the fight against infection. It includes practices intended to confine specific organisms to a specific area. We want to limit the amount of growth and the transmission. So when we're dealing with medical asepsis, we're talking about good hand washing before and after you enter a patient's room. We're talking about covering our mouths when we cough and washing our hands. We're talking about using alcoholic gel on our hands. It means washing our hands after every 10 applications of the gel. It means wiping off our bedside tables, keeping our work environment and the patient's environment as clean as possible. So medical asepsis means that we are, again, trying to fight against infection. It does not mean that we're totally without any microorganisms. Then we have surgical asepsis. Surgical asepsis involves sterile technique and practices that keep an area or object free from all microorganisms. So when it comes to surgical asepsis or sterile technique, those words are synonymous. Surgical asepsis, and sterility are synonymous concepts. We are free from infection. Now let's go into the types of infection. When you're looking at getting your patient history, assessing your patient, looking at their lab results and other documents, we're trying to determine with the physician what type of infection does the patient have. A local infection is limited to a specific part of the body. A systemic infection spreads and damages different parts of the body. And bacteremia is when the infection is in the bloodstream and the patient can become septic, which could be deadly in some cases. Types of infection. Septicemia is systemic. It affects the organs, the heart, the lung, the major organs. We have acute infections that suddenly appear and last a short time. And then there are the chronic infections that can occur slowly over a long period of time, and can last months and years. So a person with MRSA, or MRSA can remain dormant in the body for a long time, and then that flare and cause illness for several years. So that's just one example. So what are you as the nurse supposed to do? You as a student nurse and one day a practicing nurse, your goal is to make sure that you understand the chain of infection and that we break those chains. We do not want to spread infection. You want to know what to do. We are teaching you what to do. What should you as a nurse do? What's your role in fighting against infection? Well, first we want to understand that what can cause an infection. Well, there's always an agent. There's a microorganism. And when we're looking at the agent or the microorganism, we want to know how many of them are there? Is it colonized? Are there just a few organisms? And then what is the pathogenicity of that organism? What is its ability or potency to produce disease? And then also, what is the invasiveness, that an organism's ability to enter the body? So there can be a microorganism, it could be in large numbers or small numbers, and based on the organism, how likely is it to make a person sick, and how capable is the organism of getting into the body, living, and spreading infection? Your second link is your reservoir or source. People are the most common source of infection, but animals can carry organisms, bugs can carry organisms, and often your carrier or your source have no symptoms of disease at all. And then you have your portal of exit from the reservoir. So you can be personally, you could be the agent. You could be. You can be the source. You could be the source of infection. And so because you are the source of infection, if you do not, you're coughing, talking, you can spread saliva, you can sneeze, you can be through your urine, through blood or stool, we can pass organisms. So your portal of entry and your portal of exit can be the same. You might someone might sneeze or cough on you and you get pneumonia because you get that organism, but then you can also pass it in the same way. So the portal of entry and the portal of exit are the same. So then your fourth link is your mode of transmission. So organisms can be spread by immediate and direct transmission from one person to the other. You can have immediate and direct through touching, kissing. You can have indirect transmission of an organism from a vehicle or a vector, or you can have airborne transmission through droplets or dust. Again, the importance from a nursing perspective is you need to know how organisms are spread so that you can take the appropriate action to protect your patient and the hospital community if and when you have a patient that comes in with an infection. Then your sixth link is your susceptible host. The people that are most likely to become sick are the very young and the very old, and those with compromised immune systems whose WBCs are already lower. Because I told you to look up what WBCs are. The white blood cell count is. You need to know the range. because when a person becomes sick with an infection, we look for an elevated white blood cell count. But people who are immunosuppressed, those with who might have cancer, who are getting chemotherapy, or those that have an immune disease like HIV, sometimes their general white blood cell count is going to normally be low, so they are not able to fight infection. So when people cannot fight infection, when their white blood count is not at a level where they can fight infection, they are then those also that are more susceptible to infection. So that's very important to remember. Also, stressors can make a person more susceptible to infection because the blood cortisone level can decrease the antibody response. Hence why many of you might feel, many students often feel like, I was never sick until I began nursing school. Well, nursing school unfortunately can create a level of stress that can affect your immune system. Other factors influencing the susceptibility to infection can be skin problems like psoriasis. Your skin is your largest organism, so if it's broken, if you have wounds, that's a portal of entry for the organism. Certain medications like steroids, prednisone is a type of steroid. They can make you susceptible. A patient make you more susceptible to infection. Malnutrition, fatigue, stress, poor hygiene, chronic illness, age extreme, these are all things that can increase a person's susceptibility to infection, and these are things you're assessing for. So whenever you see the term factors in any general kind of in your reading or in the PowerPoint presentations, factors mean things you are going to assess for. You're going to want to assess the skin. You want to take the history on the medication that a patient is taking. This is why we teach you to assess the patient, learn to ask questions, and gather data, because that information is going to trigger for you clues that will affect your care of the patient, and it could be, helping prevent that patient from being infected by disease. So again, whenever you see the term factors, you're thinking of things I should assess for. Now, as nurses, facilities, healthcare providers, there are healthcare control programs, there are agency-specific programs, and health employee programs. And you'll get the data on those when you're working in your facility, but you should know to look for that information. There are regulatory agencies nationally that review and cite facilities on their preventive practices for infection, and so you should be aware of what these organizations are, that they exist, and you're accountable to them. Again, you should know this chain of infection, the path, what we need to do to break it. Is good hand washing and good technique. It'll definitely be on the test. Again, understanding what microorganisms are as we review the different kinds, bacteria, virus, fungi, and parasites. Understand the characteristics related to infection, and what are you as the nurse going to do. So you have these organisms, and so we want to reduce the spread of organisms. So how do we do that? We do that by certain chemical agents. If something is contaminated, we have to make it contamination makes something unclean. And so what do we do as a nurse to get rid of these organisms? We then have to maybe disinfect, or get housekeeping to disinfect, or we have to use an antiseptic when we cut our skin or scrape or We might have to do this, apply antiseptic to ourselves as well as to our patient to destroy bacteria and reduce the growth of an organism that could make the patient ill. And we have to understand the causal relationship between the problem and its cause. So if I have an etiology, if I have a patient that has pneumonia and they're coughing, I'm going to want to put a mask on them so there's a barrier between them and the healthcare workers or them and their family so that they don't spread the pneumonia. Human body area reservoirs, this is important. It's a table in your book to be familiar with. This is definitely testable material. So we have organisms. We want to reduce the spread as much as we can. We need to understand how the body can be reservoirs, different parts of the body, how they are portals of exit and entry. We want to understand again who the susceptible host is. Is a person at risk for infection, and that person could be very young, very old, with a compromised immune system, or under stress. We know that person, if they have the nutritional status, medication, previous history, can also make them more at risk for infection. So what do you want to do? Breaking the chain of infection involves you as the professional, particularly in the hospital environment. We need to do all that we can to protect our patient. So what do? We have good hand washing technique. We have handle food appropriately. We want to make sure that we have good environmental sanitation, that we have good employee health practices so that our employees do not come in ill and that they protect themselves and the patient. It's also important for you to understand who gets infected, who is most likely to become ill, but to review kind of the anatomy in terms of what does the body do to protect itself. The body has some first line defenses to protect itself, try to protect the individual. We were created with basic protection to prevent us from hopefully, getting sick. We have tears to wash things out of our eyes. We have nasal passages with cilia to trap dust and organisms. We have a urethra. Urine passes through it to cleanse it and prevents infection or organisms from traveling up the urethra. So we have different bodily defenses to help protect us. Now, understanding, I have put in here the stages or the cellular response to infection, and you should be aware of what they are, what the body does, what causes the redness. It's the dilation of blood vessels, or the hyperemia, the body trying to send blood and white blood cells to the wound to cause it to heal, to heal it, so that wound does not become highly infected, and the organism not get into this, spread into the bloodstream or something. So you want to know the second stage is exudate. Just what happens, fluid and dead tissue cells and phagocytes escape from the blood vessels, forming exudate. And so the exudate, key here in exudate, means drainage. You as the nurse do assess the color, quality, and state of the drainage from any wound. So you need to know these terms. What is serous? What is serosanguinous with blood? And what is purulent, cloudy or green or yellow drainage? And the third stage is the reparative stage, the regeneration of tissue with the replacement of scar tissue to make the person well. The specific defenses that your body has, are directed at the identifiable organisms. So you have your humoral immunity. The antigen is antigen-induced formation of antibodies. Antibodies help fight infection. So there's two types of immunity. There's active immunity. The body produces its own antibodies. So when I was growing up, there was not an immunization for mumps. So I had to get the mumps, and so I now have active immunity against further illnesses with the mumps. Passive immunity happens, active immunity can happen by natural antibodies produced, which when I got the mumps or chickenpox, that was a natural immunity. And your acquired or artificial immunity is produced by your vaccines. So it's important. This is testable, very important information. Passive immunity, the body receives antibodies produced from another source, and the most common is the mother's transfers immunity to her infant. Cellular immunity occurs through the T system, and you should really just know here that your T cells are your your helper T cells or your immune system, and your cytotoxic T cells kill microorganisms, and your suppressor T cells suppress T cells. Just be aware of it. Okay, risk for infection. Again, this is what you're going to assess for. Factors, risks are things you're going to assess for. So the risk is the state in which an individual is at increased risk for being invaded by pathogenic organisms. We determine these risks through our nursing assessment, laboratory data, and physical assessment, and laboratory data. We're looking for pre-existing conditions, medications, nutritional status. We're doing the physical assessment as you've learned, or will be learning in skills, looking at the vital signs, skin condition, lymph nodes, lungs, drainage. And then you want to make sure that we wash our hands. We want to make sure that we have good hand washing. You can never wash your hands too much. Always want to wash your hands before and after you enter a room. And this is again review from nursing assistant, understanding the importance of good hand washing and how you do it. You should know how to wash your hands and do it often. There's a rationale here for each step. It's in your book. Now, donning your PPE is really a skill you learned. Your personal protective equipment, you should know what they are. You're going to see it on a test. Gowns, gloves, masks, all how to put them on are all review skills from nursing assistant. But we will talk more about how you protect your patient in part 2. But again, we want the best defense against infection has to do with good hand washing. So again, you want to understand what kinds of what an infection looks like. What are the signs and symptoms? When you have a local infection, you might see, and this is very testable, so you need to understand the difference between a local versus a systemic infection. So again, just to back up, we understand what causes infection, that there are kinds of infections like nosocomial infections that are more difficult and resistant to treatment. We understand that there are certain populations that are more susceptible to infection than others, that getting a good health history, understanding the medications, stressors that a person's under, their lab work, their starting white blood cell count can impact how susceptible that patient is for infection, and that we need to assess for these things. Hand washing is the best defense. So what do we need to also know? We need to assess for the local versus systemic infection. Your local infection, say you cut your finger, you might have swelling, redness, pain, tenderness, and the ability to move that digit or limb will be impacted. A systemic infection or sepsis is going to be identified by the patient having a fever. If they have a fever, they'll have potentially an increased pulse, respiratory rate. They may have malaise or be tired, loss of energy, and they may have swollen lymph glands. So you need to assess, and it's important to understand that a local infection can become a systemic infection if it's not properly treated. So you need to understand what you're assessing for, local versus systemic infection, and you need to understand that, remember, you as the nurse are always preparing for the worst thing that could potentially happen. So we don't want a local infection to become a systemic infection, but you need to understand that potential exists, and we need to do our best to prevent it by good hand washing techniques and assessing for the additional needs of our patient. Understand again your laboratory data, and also understanding the factors again that can make people, put them at risk for infection. And then what are we as the nurse going to do if we have if we notice that a patient we've assessed that they have a risk? What are we going to do? What are our goals, and what are our outcome criteria? What are our goals, and what do we want to see happen? So then there are certain interventions that you want to have as a nurse to prevent the spread of infection. You want to assess your and document any sites wherever you see broken skin. You want to assess the vital signs and lab work. You want to make sure you use appropriate technique, and definitely wash your hands and teach the client safe sexual practices. You also want to make sure that you encourage your patient to be up to date on their immunizations, have good hygiene, to cover their mouth and nose when sneezing. And you also want to teach them the signs to be aware of as related to infection. You want to assess always for any changes in condition. You can admit a patient, you could be on a surgical floor and admit a patient because they had their gallstones removed. It doesn't mean that patient can't suddenly have pneumonia or some other be compromised by some other infectious agent. So you will have to you're always assessing for a problem, even though that problem is not identifiable at that point, at an immediate point in time. You're always planning for the worst, if you would. You want to have your pharmacological concerns because your pharmacological concerns can impact your patient's response to treatment, and also the antibiotics patients are put on can have side effects that can cause some discomfort. So important is before people have infection, you need to know your patient's allergy status, their kidney function. Everyone cannot have the same kind of antibiotic treatment if they don't have the kidney function to tolerate it. Antibiotics can cause diarrhea. patient with constipation can be more at risk for an infection. Superinfections are MRSA, and VRE. They're difficult to treat, and they can lie dormant sometimes in the body. And some people can because they've been on antibiotics so many times, they may have an antibiotic resistance. Now, the superinfection and the antibiotic resistance are going to be determined by the lab cultures and sensitivities from the lab, but you need to be aware that you might need to look for it. And when you are administering antibiotics, you want to, particularly when you're giving a patient an antibiotic for the first time, you want to make sure that they know that they have their call light, and if they have any symptoms of itching or feeling different, to put their call light on right away. You need to understand that some antibiotics, though necessary, can cause discomfort, like thrush in the mouth. It can cause C. diff or C. difficile, which is an infectious organism in the bowel, in the intestines, and so they'll have lots of loose stool because the antibiotics can kill all of the organisms. And then you have your drug-resistant organisms like MRSA and VRE. Because, as I told you, germs learn. When they learn, they mutate and become resistant, which is why in hospital-acquired infections are so difficult to treat. Therefore, we as nurses must do everything that we can to protect ourselves and the patient. That's all for part 1 of infection. Make it an asepsis. Make it a great day.